I really can't practice medicine without it anymore. I've been a physician now for 50 years, and I honestly don't know how I practiced before Epocrates. It's certainly not in an efficient manner. Our clinic is the only free clinic in Martin County, Florida, and people without insurance, people who are 200% above the poverty level, qualify for comprehensive, complete medical care here. And the important thing is, how many patients can we see in a given day or in a given time period? Well, that is enhanced so incredibly by the time we save using Epocrates, not having to go to a library, not having to say to a patient, well, I'm not sure, I'm going to have to look that up, not having to go to the PDR to see if I can start this new prescription and is it compatible with the other medications the patients are on. Take out Epocrates, type in the medication the patient's already on, click a checkbox, and if it's compatible, you know immediately. The time saved is enormous.
I like it. It lets me know he's got more information at his fingertips than, I ask a question and he has to run off and check a book or not sure the answer. This way he's got it right here, in his pocket and can answer any question that I might have. He's been practicing for so long. He's been doing this for so long. He's seen so many people. At least this way he's getting the right information if he's had a long day or he's had 5 other patients before me, and this way I know he's getting the right information to for my situation right off the bat.
Well, it was an interesting experience to have to do that. I woke up one morning with a small mass in my right breast, and there is a condition of in men. That's breast cancer, same kind of breast cancer that women get. It can be quite deadly. However, I did know as an internist that as a side effect of various drugs, a condition called gynecomastia can develop, which just simply means enlargement of the breast. And I have hypertension, for which I have medications. I recently had started on new medication called spironolactone, and I immediately took out my Epocrates, looked up spironolactone, looked for adverse effects, which you can do with your Epocrates, and right there, first on the list, gynecomastia. So within seconds, I knew I didn't have breast cancer. Quite a relief, thanks to Epocrates, and was able to go out about my business without any further concern. Well, one of the things that we have to take into consideration here in the clinic is that our patients are poor. One of the topics that is available in Epocrates is called RX. You can not only look up the drugs that you're interested in ordering for the patient and the dosages available, which is very important. I don't have to memorize every dose form that's available in every drug. You can also look up the cost of that medication to the patient. And if the prescription for a week's medication is going to cost in the hundreds of dollars, obviously my patients can't afford it. So I can look for alternatives. So that's a very important part of that. Well, saying that I can't practice without it is a pretty shameless plug, but it's really true. Everything I said is true. It's a fantastic device because it saves so much time on a single patient to have information, so much information on your fingertips, and to have a pocket full of a medical library, which is something that's irreplaceable.